You mentioned albuterol. What are some of the common treatments that a child might be prescribed for asthma?
Well, typically now we divide the asthma medication into two groups. One we would call relievers, or quick-acting medications, and those are usually what we call bronchodilators, where albuterol would fit into that. And that's because it's a quick-acting medication that tends to relax the muscles around the airways. And they can particularly relieve the symptoms of wheezing and shortness of breath at that time. The second category would be the anti-inflammatories, or combinations of such, which we tend to also call controllers. These act over a long period of time, and they work to reduce the inflammation in the airways. Uh, common things are like that are corticosteroids, or some of the called interleukotriene modifiers, are tend to be in that category.
One thing we've heard a lot about from parents, especially mothers, um, about the albuterol is the hyperactivity that seems to follow it. Um, and also concern about side effects and asthma treatment in general. What should parents know about side effects and asthma treatment medications?
Well, one thing we know, there's probably no medication that anyone can give or we make that's going to be without some side effects. But I think we can do things to minimize those side effects. And certainly, if a parent notices something that they think is a side effect, they should speak to their doctor as soon as possible. So techniques can be done to minimize those side effects. For albuterol, particularly, uh, that category causes the hyperactivity. Sometimes that's related to quite a bit of the medication getting into the blood system, being absorbed in the mouth. So using a spacer device may benefit using the uh, the albuterol inhaler. The other thing that's most important is getting the asthma under control. If the asthma is under control, it's going to be less likely that a child is going to need to use the albuterol inhaler.